A healthier, happier life begins here. Welcome to Mercy Moments, a podcast by Mercy Health in association with True Chat.
Did you know May is Mental Health Awareness Month? And this year's theme is Tools to Thrive, chosen because of the COVID-19 pandemic and the ways that trauma, sudden illness, and cancer can affect mental health. In fact, it is now estimated that 1 in 4 people will develop cancer in their lifetime. And good mental health is often a key to recovery and survival. Thank you for tuning in today. I'm your host for Mercy Moments, T. Allen Ceyler, coming to you from Champaign County here at True Chat Studios in Urbana, Ohio. Our guest today is a licensed professional clinical counselor at Mercy Health in Springfield, Ohio. She specializes in working with people who have experienced a sudden illness, trauma, or even cancer. Please welcome to the program, Cindy Batie.
Thank you, Terry. I feel honored to be here. Thanks for having me.
So can you tell our listeners a little more about yourself?
I am, as you said, a licensed professional clinical counselor with the state of Ohio, and I have been working as a counselor in Springfield for the past 11 years at City Lookout, which is a nonprofit in Springfield, Ohio. And we specialize there in trauma. And then I had the opportunity to go to the Mercy Health Springfield Cancer Center and work there 1 day a week with their cancer patients.
So how would you describe the current state of mental health in America?
Well, unfortunately, Terry, I would say that at this time in our country, our mental health as a whole is very poor. So many things have happened, not only, of course, the coronavirus that we've all are cognizant of, but we've had an election this past year. We've had so much diversity, but then also charges of racism in our country, and just all the changes that have happened because of the COVID, of being mandated to stay at home, not working, many places being shut down. It's caused just tremendous mental health issues in so many different areas.
So is this partly due to COVID-19 as well?
Yes, of course. People losing their jobs, people, just the fear of their mortality. Am I going to get the virus? Will my parents get it? Will my grandparents get it? There's been so much uncertainty, and oftentimes there's been some mixed signals of how to do it and what to do it. And people are just tired. They're ready to get out. They want to get back to a normal type of life.
So are there any other factors other than what you've mentioned already that have contributed to some of the mental issues in America?
Sure. I would say with our youth, especially our 18 to 24-year-olds, we've had a lot of senses of isolation, fear for their futures. The suicidal rate has increased in that area. We've also just had people in our adults worrying about their jobs, what the future holds, kind of putting their lives on hold. And then in our older population, of course, with our more elderly senior population, there's been an increased sense of isolation.
Now, I know you guys also deal with people that have certain cancers, correct?
Yes. Well, at the Cancer Center, we treat all types of cancer. And so therefore, I treat whoever has been screened and has been recommended for counseling.
So what exactly happens to someone when they hear the words, "you have cancer"?
Wow. When somebody hears the words, "you have cancer," people almost always equate that with a death sentence. They think that cancer equals death. You know, everyone reacts differently, so there's no way that is right or wrong. But for most people, it is a tremendous shock. It's a disbelief, fear of the unknown, thoughts of, am I going to die, are very, very common.
In the mental health community, you often hear the term distress. In clinical terms, what does the word distress actually mean?
Well, clinically, we would say that distress is kind of a step up from just having what we consider circumstantial anxiety or depression or sad moods. But when a person is tremendously distressed, that usually involves them, for example, not being able to get out of bed, thinking about death on an ongoing basis, feeling like there's no reason to live, just a sense of doom and dread and not thriving.
So what are the types of emotions that a person distressed might experience?
Like everyone at the beginning of their cancer journey, there's fear, there's the loss of identity, there are the feelings of, how is my family going to cope if I die? How is this changing my relationships with my significant others and my family, my children? And it really does take time to accept. The numbness, the feelings of disbelief, and the denial actually at the beginning can be very helpful. And they can kind of help you to gradually be able to come to terms with your diagnosis.
So can you explain the actual stages, though, that go along with distress?
Sure, I would love to. Well, like I said previously, everyone reacts differently, and there is no one way that is right or wrong. So for most of us, we go through the different stages of fear, anger, anxiety, worry, depression, feeling very overwhelmed, loss of control of our life, loss of identity. And it takes quite a long time to come around to feelings of acceptance. The loss of our health, impacts all parts of our being. The possible loss of our job. Will I be able to work? Will I become a burden to my family, to my spouse? How are we going to pay the bills? How are we going to, provide for the children? What about our mortgage payments? Why me? On and on. We think, will I die? Is this treatment even going to work? It's just a total loss of control of life. And it does take time to accept. These feelings of numbness, of disbelief and denial, even though they can protect you for a while, they do need to be worked through. And when a person is not able to, with the support of their family, that's where counseling can come in, can be very helpful when sometimes not even the individual realizes, but maybe their family or their doctor, that they're stuck and they need extra support through counseling.
We'd like to take this time to remind our listeners that all of True Chat's podcasts help pursue a common goal: to educate people by providing honest, open, and respectful conversations. To learn more about Mercy Moments, listen to the recap at the end of the program. And to search for previous episodes or find ways to listen, please visit us at mercymoments.org. Welcome back. So just to recap, our conversation today has been about unexpected illness, mental health, and cancer survival. And my guest today has been Cindy Batie. Cindy, welcome back.
Thank you so much, Terry. This is such an important topic, and I'm so glad to be able to be here and maybe shed some light on the subject and offer hope.
So how do you help someone who is in distress deal with their feelings?
Well, that is a very good question, and I could go on and on about the answer for this, but one of the very first things that I tell a person is to learn all that they can about their cancer diagnosis. Learn and study and Google and ask questions, read books. The more you know, the more that you're going to feel like you have control. And then I say, get to know your cancer team, your cancer care team. Talk to your doctor, talk to your nurse practitioner, ask questions of the nurses, seek out any resource that your cancer center has. For example, we at Mercy Health Cancer Center, we have exercise programs specific for cancer. We also offer massage. We have a wonderful ministry of helping women with their hair needs, for coping with their hair loss. And then again, also, I think it's just so wonderful that we have introduced counseling into the team to help people with their diagnoses.
So how does someone know when they need help?
Well, like I said earlier, when you get to the point where you don't want to get out of bed, you don't want to go to treatment, you just feel hopeless, you're not able to cope with even maybe taking a shower, you don't want to talk, you isolate yourself, that is when hopefully your family or you yourself, if you don't have the strength, can go and get counseling. Often, too, our doctors, they all do screening. They do a mental health screening in the office. And so they themselves often recommend somebody without the patient asking for the help, because it's very hard for people to ask for help. People feel like they have this thought that they have to be strong and carry this burden, and they don't want to upset their family any more than they already are. So they suffer in silence, and that is something we absolutely do not want for any of our patients, is for them to feel like they have to handle this alone. You are not alone, and we want to help you, and we're there to help.
So I think you touched on this a little bit earlier. What are some of the self-coping mechanisms that are available?
Okay. Like I said, we have the exercise. We have tons of information. We actually even have a little library that you can go and get any kind of information you want. But then when we are talking about what can a person individually do, by coming to counseling, first of all, just talking it out can be so therapeutic, and it can help a person get things off their chest that they don't want to tell their family because they don't want to burden them. And maybe they are afraid if they tell their family, it will frighten them or scare them. But they have a confidential, safe place to talk out their deep feelings and be able to let go of that so they can use that emotional energy to fight and battle their cancer.
I think we've pretty much answered this question, but are there any other types of processes that are available to people?
Yes, of course. And that is what you can learn in counseling. In counseling, you can learn so much. Besides the fact that you have a safe place to explore your feelings, process your feelings, become more self-aware of what is happening within you with your feelings and your thinking, and to gain insight, you can learn coping mechanisms, and you can become more of an actor in your life instead of just a reactor to all that's happening around you. You know, even some simple things of being encouraged to journal daily, just to get those feelings out, to exercise, just to get some outdoor activity. You know, I tell my clients and my patients that we were created in a garden and we were meant to be outdoors. It can be very soothing and therapeutic for a person and healing. But then also things like making sure you breathe. You know, often we forget that breathing is, of course, essential to all of our health. But a lot of us, when we're upset or stressed out, we hold our breath and we don't realize we do that. So practicing throughout the day, really cleansing breaths can be very helpful. So learning things like that, but it's very simple. Just breathing in through your nose, holding it for four counts, and then breathing out for 4 counts. And maybe in your mind, even thinking of the word relax as you breathe out. But things of this nature are things that can help a person, but it does take practice, and you do have to be committed to wanting to feel better.
So at the point that somebody thinks they need help, what exactly is the process that has to be followed?
Well, that's a good question, because we want our people to find us and to come for counseling. Often, like I said, the doctor does screening of every patient, and so he will recommend that person for counseling. And so then our social worker, who we have at the Mercy Health Cancer Center, is Ann Himbry, and she is just a tremendous person and resource person for us. And so then she connects me after the doctor lets her know who needs counseling. Then she contacts me, and then we set up an appointment, and that's how that happens.
So how does the support differ amongst different segments of the population?
Unfortunately, there is some stigma in some populations associated with cancer. So a lot of times we find that men in particular are a little more hesitant to come to counseling than women. Women are usually our first people in line, but then also our different populations of Black, Latino, their cultures are not as open to counseling. And so it takes a lot of encouragement to get these different people to come in.
Does age play a factor as well?
It does, but I have seen in the last 10 years that I've been counseling that more and more of our elderly population are willing to come because they are so lonely and isolated.
So how is your organization funded?
At Mercy Health Cancer Center, we are funded through a lot of grants through the Mercy Health Foundation. And then at City Lookout, it is a nonprofit, so it also is funded through private donations and also through grants.
So where exactly are you guys located?
We're located in Springfield at 148 West North Street. And our phone number there for you to contact us is 323-5001. And if you are feeling like you need counseling, you feel like you're in any kind of crisis, we ask you to please call. We would love to help you in any way that we can and be supportive of you. We do not want you to suffer alone.
So are there any additional resources that our listeners might be interested in?
Yes, thank you for asking that, because like I have said earlier, we do not want anyone that has a cancer diagnosis to suffer alone. The first resource I would love to share is just to remind everyone of the American Cancer Society. It is not only a fundraiser, but it is an organization that will help you 24 hours a day, 7 days a week. And I've checked it out myself, like at 11 o'clock at night on a Sunday. And they answer. You maybe have to wait and go through multiple prompts, but there are times in a person's life when they're battling cancer that they feel very alone. And often it can be in the middle of the night when you're not able to sleep, you're feeling nauseated, and you just need someone to talk to. The number is 1-800-227-2345. They are not licensed counselors, but they are lay people that are very dedicated to offering kindness and support. Also, then there's the Mental Health of America. That is a wonderful organization that you could Google and find their website. But then I'd also like to just encourage also people that there is an organization, and we have an active chapter in Springfield called the National Alliance on Mental Illness. It's NAMI. And they do wonderful classes for even families. They have family classes to help them to understand what a person is going through when they're having any kind of anxiety or depression. And they are a very, very wonderful resource group. So like I have said, as hard as it is having cancer, many cancer survivors say the experience has led them to make important changes in their lives, and it's helped them to really learn and value the gift of being grateful for each day and the people in their lives. And there is also hope. Lots of hope. We have so many survivors now living long and fruitful lives.
So in regards to City Lookout and the Cancer Center, where are both of those located?
City Lookout is located at 616 North Limestone, and the Cancer Center is located at 148 West North Street.
And what's good contact information for either one of them?
Well, City Lookout's phone number is 322-6532. You can call and schedule an appointment there. And then at the Cancer Center, you can call 323-5001.
A quick reminder, in addition to May being Mental Health Awareness Month, it is also the kickoff for lung cancer awareness. In fact, Mercy will be holding lung cancer screening events in May and June. Also, for any comments related to past episodes or suggestions for future programs, please contact us at taceyler@mercy.com. That's capital taceyler@mercy.com. Again, I'd like to thank my guest today, Cindy Batie, for being here. You can listen to Mercy Moments on TrueChat via Spotify, Apple Podcasts, Stitcher, or anywhere else fine podcasts are found. For Mercy Moments, Mercy Health Urbana Hospital, and TrueChat, I'm your host, T. Allen Ceyler.
And I'm Cindy Batie.
Thank you for listening today. Stay healthy, Ohio.